I'm going to wash my hands to prevent the spread of microorganisms. So, hi mom, I'm Wensi, your nurse today. How are you?
I'm good.
So, may I know what is your name?
I'm Francis Eliza Montal.
So, Mom Eliza, we're going to do an assessment of your cranial nerves. Is it okay with you?
Yes.
So, I'm going to close the curtains and doors to provide the patient's privacy. So, first is the olfactory nerve, and it is a sensory type, and it is for our smell. So, Mom, I may request to include your one nostrils. Then guess what kind of scent is this?
Coffee.
The next side.
Coffee.
So the patient identified the scent correctly. Next is the second cranial nerve, which is the optic nerve. Optic nerve is a kind of sensory type, and it is for our vision. So first, we're going to test the peripheral vision. So mom, please stand up and try to cover your one side of the eye. Then focus on my eyes and tell me how many fingers I'm going to show.
2, 1, 3,
Next side.
1, 3, 2.
So the patient acknowledged the number correctly. Next is the uh, visual acuity by using the Snellen's chart. So mom, please read the lowest letter that you can by covering your one eye.
T, E, Z, C, F, D.
Next side.
E, D, F, C, Z, P.
Both eyes.
E, D, F, C, Z, P.
So the patient has a normal vision acuity since the eighth line is for the normal vision which is 20/20. So next we're going to the third cranial nerve, which is the oculomotor. The fourth is the trochlear nerve. Then next is the abducens nerve. The oculomotor is for the innervates eye muscle and ciliary muscle. The trochlear is for the superior oblique. Then the abducens is for the external returns. So first we're going to assess the extraocular movement. So we're going to I'm going to do the 6 cardinal field of gaze. Follow my fingers. So as I observe, the patient's pupils direction is smooth and coordinated. Next is the we're going to assess the papillary reflex. So we're going to dim the door, and I'm going so the pupils are bilateral, illuminated, and constricts simultaneously. Next, we're going to assess the accommodation. So pupils are equal, round, reactive, and reactive to light accommodation. Next, we're going to please sit down. We're going to the fifth cranial nerve, which is the trigeminal nerve. It is for the chewing movement. So I'm going to palpate the masseter, the temporal. So, temporal and masseter muscles contract bilaterally. Next is the fifth, the seventh cranial nerve, which is the facial nerve. So, it is for the facial expression. If I tell you to smile, please smile. So, okay, please, mom, please smile. Frown, sad. So, symmetrical facial contours, lines, wrinkles, and symmetrical facial movement. Next is the um, vestib, the acoustic or vestibulocochlear nerve. So, I'm going to whisper something, then guess what word is this?
The speaker.
Computer.
Computer lab.
So, the patient clearly hear the words that I whisper. Next is the glossopharyngeal, and the next is the ninth, which is the glossopharyngeal, and the vagus, the 10th cranial nerve. So it is to swallow movement. It is swallow movements and saliva secretion. So open your mouth, then try to speak something. So, the uvula and soft palate rise bilaterally and symmetrically on phonation. Next, so the gag reflex intact. Next is try to swallow. So the client swallow without difficulty. Next is the accessory nerve, which is to the accessory nerve, which is the 11th cranial nerves, and it is to innervate sterno sternocleidomastoid mastoid and trapezius muscles. So, if I tell you to heads up, then down, right, left. So, the client does it with ease. Next is the hypoglossal, which is our 12 cranial nerves. It is a type of motor. Then, try to open your mouth, and protrude your tongue. Move it from side to side. So as I observe, the patient um, does it with ease. So I'm going to wash my hands, then to prevent the risk of spreading of contamination. So mom, the result of the assessment of your cranial nerve is all normal, since I don't have any abnormalities seen. So thank you for your cooperation, and God bless.